So welcome everyone from around the world. In fact, just this morning, I got 2 emails, one from Brazil and one from Switzerland. 2 people who have been regularly participating. So we never know who else is listening in, but we're so happy that so many of you from around the world are joining us. So this is the Women in Public Policy Program seminar on behavioral science for inclusive organizations. And my name is Iris Bonnet. So first, a bit of an announcement. As probably all of you wherever you are know, there's a bit of a frenzy going on in the United States today because of the solar eclipse. Boston is not quite in the path, but almost, with 93% of the sun covered. So we will in fact take a break at 25 minutes past the hour. I know you're all in different time zones, so that's why I'm saying 25 minutes past the hour. We'll take a short break of 10 minutes and then we'll be back here. Kim Desmond, our speaker, has graciously agreed to this unusual break, but I was nervous that half of our students would leave if we didn't, in fact, take a real break. So it'd be a shame if we missed some of Mrs. Desmond's comments. Importantly, and also graciously, she agreed to stay an additional 10 minutes at the end. So those of you who can stay 10 minutes past the hour, virtually, please do so. We welcome you to stay longer. And thank you so much, Kim, for doing this. So with that, I'm going to introduce you. I'm super excited to have Kim Desmond here today. She is the Chief Race and Equity Officer for the city of San Diego, where she's leading the Department of Race and Equity for Mayor Todd Gloria. Kim has a long history in DE&I, particularly focusing on race equity. And importantly for our purposes today, she's also has extensive experience in doing research on this particular topic. In fact, I was introduced to Kim Desmond by one of our colleagues here who has worked with her quite extensively already on the randomized controlled trials to better understand what works and what doesn't work in the public sector, in San Diego, in Denver, in other places around the world. So, Kim, we are so excited to learn from you, but also so grateful for your expertise and your passion to bring real evidence to bear on this question of equity and inclusion. And with that, let me turn over to Kim Desmond.
Thank you so much. I'm a fan of yours as well. So thank you for what you've contributed to the field, most certainly. And I'm excited to be here to talk with you all virtually. And I know that there's some of you all who are in the class, and there's some who are joining us via Zoom. So I'm excited to be here to have this dialogue for today. So let's get started. And of course, you got to throw in the eclipse. So that's the thing. So let's get started. That way I can make sure that we get plenty of time for the presentation. I'm going to share my screen. Give me 30 seconds. All right, and Laura, you're my gauge to make sure I get everything up and running. Am I good?
Great. This looks great. Perfect.
So, as Iris stated in the introduction, thanks for that. I most certainly have had the honor. I got to just start and acknowledge my good friend and who I've worked with, Dr. Elizabeth Linos at the People Lab with Harvard Kennedy School. If you hadn't had a chance to check out some of the work and projects, Laura's going to pop a link in the chat for you all to check out. So just note that I've worked closely with Dr. Linos on several projects, and some for the purposes of the presentation I will highlight today. So let's go ahead and get started. So I have the honor of actually working within currently the city of San Diego as the first inaugural equity officer, just recently appointed within the last 2.5 years by Mayor Todd Gloria. I also have the honor of working in the city of Denver as the inaugural director of the racial justice work, which was the first office. And so I like apparently being the first in some of these positions. And so I had the honor of doing that. So a little bit of background to you all is I think it's important to talk about the policy context for this office. So the policy context for this office includes the actual establishment of the office through an ordinance. And I always bring up and talk about former council president Monica Montgomery Stepp, who is now a county supervisor in the county. And I credit her to deliberately creating this office and also creating a budget that goes along with it. And so that's the history of this work. This work in San Diego, outside of me being appointed by Mayor Gloria, is this work will continue. When it's created by an ordinance, it does not give an option for it to just be removed rather quickly. And so this work is embedded in the municipal code. And so I always have to start out by saying doing equity work is not easy work, and it makes a lot of people uncomfortable. And so to have it within an ordinance, it most certainly gives it some staying power. So with that, here's the timeline of this office, which includes the office was actually created at the height of the murder of George Floyd. And so with that, around the country, equity offices expanded by over 200, right? So we're at probably the national partners, I would say over 450 offices, which prior to George Floyd was around like maybe 125. And so San Diego is one of those offices. And so in that, July 2021, appointed by Mayor Gloria, and then where we're at right now is I've hired staff who have joined the team to continue the work, and we are continually moving forward with building out this office and hiring more staff to do the things that actually connect to our model. So with this, I wanted to spend some time on this particular model because I think it's important to actually frame the work. One of the main questions that I receive is how do you dismantle systemic racism within local government? And how do you partner with department directors and elected officials to move the work forward? And so when I started this position, this is my second office I've had the honor of being a part of building. I knew that it was important to start out with building an actual operationalizing equity model, only because in local government, you're working with over 30 departments and over 12,000 employees. When you're trying to get folks to walk towards or move towards one direction, it's important that you kind of have a clear vision of the work. And so with this, our work is guided by the outside pillars, which one is the domains of our work is we always strive to partner with folks strategically, and that includes our department directors. And so strategy is a key part of work as we are guiding our partnerships. You're going to hear a lot about us leading with data-driven practices. That is most certainly a core commitment to my work in this space. And also you're going to hear about learning and development in terms of how do you cultivate an equity mindset and the importance of community engagement. Now, this particular model is actually aligned by the domains revolve around the 5 key steps. And so the 5 key steps include what we call is creating tactical equity plans. These are goals and objectives that each department creates to move the work forward and identify clear disparities and really set a path forward to address those. The other part with that is this local government is charged with a massive budget. And so our work is actually integrated into the entire budget process. And with that, we make sure that the budget has an equity lens. And for every strategy that our departments create, we want to make sure that they're leading with utilizing taxpayer dollars to ensure that we are achieving our strategies in a very strategic manner. So step 2 is equity lens in our budget process. The city budget under the mayor is $5 billion, and every department in San Diego has to work with my team to critique their budget adjustments in our requests with an equity lens. And then our team, we work with them to implement their TEP, which is the Tactical Equity Plan. And that's their clear goals and strategies to move the work forward. And as a part of that, we then go to step 4, which is monitoring the process through equity-centered coaching. As I stated, we have over 30 departments. So my team, we meet with them every month to monitor how they're moving the strategies forward and how they're partnering with the mayor's office to make sure that we are executing at a high level of efficiency. And then we want to optimize our impact to address the complexities within our local government systems. I always like to tell individuals that there's no simplistic solution towards complex government root cause issues that folks are navigating in our city. We have over 1.4 million folks in the city of San Diego. And we want to make sure that as we are putting together solutions, that we understand that things are complex. It's complex to create new policies and programs. It's complex to create budgets to make sure that we're getting or providing the services that individuals are needing in their neighborhoods. As a part of that work, my team is charged with partnering with the mayor and our chief operation officer and our deputy operating officers to cultivate what I call an equity mindset. And so an equity mindset is one where we want to make sure that all of our employees outside of my team being in the room with them, that they are cultivating the mindset in how they do their work. And so we want to make sure that our employees, all 12,800 of them, are thinking about ways to continuously address and identify disparities and also identify root cause solutions to those types of things. The other thing is that we want to make sure that people are being inclusive with the way that they speak in their work environments. And we got to be very clear in that the way that individuals interact with our community members, we want to make sure that they are doing so with an inclusive positioning. And with that, we want to make sure that they're saying things that are aligned with making sure everybody's included, making sure that everybody belongs, and understanding that their city government is there to serve them. Servant leadership mindset is how they interact with the public. A lot of individuals in our city, a lot of individuals in general, are not clear what local government was built to do. They're not clear that government was built to fix your roads, built to make sure you have quality water, built to make sure that your transportation system is running efficiently. And so we want to make sure that as we're interacting with our different council district neighborhoods, that we're doing so with a servant leader mindset, meaning that we are here to serve the individuals in our city. It is our goal as civil servants in local government to serve the individuals who live in this city. Last but not least, an equity in action mindset is what we do. It is not enough to just talk about the work. We want to make sure that people are doing something to support people and to provide them with access to information to address their individual needs. And so equity in mindset is the action part. And so when you hear me speak throughout today, just think about we're cultivating a mindset, the way that we interact with folks, the way that we produce results. That's really important because people want to see what you're doing for them and want to make sure that you're treating people well, more importantly. Government exists. Our goal is to make sure you have what you need to thrive and that we're treating you well. My team, when we provide coaching to our departments as a part of creating our tactical equity plans and strategies, is we make sure that every department understands that our mayor has charged folks with being committed to equity. And that commitment means that you are committed to understanding that historic and structural inequities are embedded into the structure of our systems. And this means that we have to grow and learn what it means to identify historic disparities. How do we identify historic structural racism? And how do we make sure that we're creating new policies and practices, more importantly, to address the disparities that connect to historic systemic racism? So think about historic policies like redlining. In San Diego, we had an epic storm here, and the neighborhood, in the places that flooded, those neighborhoods were actually historically redline neighborhoods, meaning that across the country, this was neighborhoods that legally, if you were a person of color, you could not live in a particular neighborhood. So based on that, the infrastructure in those neighborhoods is not at its highest standard. And so a commitment to equity means you understand that when that flood hit our city, that the majority of the individuals actually also lived in historically red light neighborhoods, and the majority of the individuals who hit the impact of the flood was our African American and Latino folks. And so a commitment to equity is understanding that. We want to make sure that we communicate with our city department employees. They are also our stakeholders. I tell folks all the time that if we don't treat our employees well, they're not going to clean your sewers. They're not going to clean your parks. They're not going to do the things to make sure that you have the clean drinking water. And so we want to make sure that we're treating our employees well and addressing their needs in terms of keeping that communication to make sure they have all the things they need to thrive as employees. We want to make sure that we're looking at our programs and our policies and our budget decisions to address any individual or systemic bias. The way that I know this is a behavioral science class, and we have other folks around the country who do a lot of behavioral science, cognitive science work, and that our brains are wired to categorize individuals. And we want to make sure that we are de-biasing our decisions. And so my team, we come in and we make sure that as we're creating new programs and policies and are revising policies, that those things are not creating a disproportionate impact. Collaboration is key. Government cannot do all these things alone. We collaborate with lots of different entities, including for-profit, nonprofit, state government, federal government, and we want to make sure that we recognize that these partnerships will help us address the societal issues as well as the disparities that have been part of the institutional knowledge of our country, and that we see them in every system of health, education, and housing. And so collaboration is key. That then leads to the holistic approach. Everything in our system is interconnected. So turns out when you build a house in a city, it's also built next to a school. It's built in a street that may have a pothole. And that same neighborhood may be built next to a dam or a levee that if it was to not function, there would be high levels of flooding. And so we want to make sure that we understand the environmental impacts to our work, and we understand the consequences to not looking at things holistically. Where you live at is where you go to school at, and also you also work in those same areas. And so our holistic approach takes into consideration how we don't live single issue lives. Now, with that, our team in these sessions, we talk about strategies. We sit in on a lot of requests for proposals to ensure that our contracts are equitable and inclusive. We make sure that our budget is equitable as the mayor puts forth the budget to city council. You're gonna hear a lot about our data-driven practices. And with my particular role, I'm able to work with the mayor's policy team to look at ways to integrate equity into policy decisions so the mayor can put forth those things to city council. So these are all the things that we do. As I stated earlier, you can't solve racism with one approach. And so our operationalizing equity model includes race and social justice training. We want individuals to understand that the role of history creates current day disparities. And we actually offer a race and social justice academy where we make the connection between past policies like historic redlining and how that creates disparities in home ownership for Black and Latin folks. And so our training makes that connection to past policy and current day disparities to prevent us from making future decisions that create more disparities. And so just know that we offer training to all of our departments. And I'm excited to say that our mayor actually sat through a full day of training with our team, actually 2 weeks ago, last week, around ways that he can continually be a champion for this training, but also ways that he can grow his own thinking around integrating equity in his particular lane of influence. This next slide is important only because there's a lot of conversation around what is equity. Simply stated, equity is about addressing a disparity. I tell individuals who I am partnering with in coaching sessions that if you cannot identify a disparity using data, then you're not doing equity work. I also tell individuals that you have to go through equality to get to equity. So a simple way to look at this is that equality simply stated, is that we all need water to live. Every human person, we need water to live. That's an equal standard. Equity looks like not everyone has access to high quality drinking water. Or you may live in an area that's higher prone to flooding based on where your home was built. And so to get to equity, you got to set an equal standard. You have to say, what does everyone need to thrive in our neighborhood? And then equity takes into consideration that not everybody is meeting that standard. The example being homeownership. Homeownership rates are at a despairing gap for people of color, not just in San Diego, but across the country. The same thing in health and in education. And so there's not a system in this country where you don't see inequity that traverses racial, ethnic demographics. And so with equality, you want to set the standard. And then you say, who is that not true for? Who's not meeting that standard? And then you individualize to make sure that individuals can get what they need. An equity lens, it's just a set of questions. There's no cognitive science to this particular word. An equity lens are just questions that we ask ourselves to critically think about our decisions as we analyze our policies and our practices and our budget decisions. A lot of city employees, they make decisions based on their experience and based on their access to resource. And we want to make sure that they're taking time to say, what are we not considering? And so we do have some classic equity lens questions that lead folks to understanding how to do that. I'm going to get through this slide and then give you all some time to take a quick break for the solar eclipse. I know it's coming up at 12:25, if that sounds good. Laura?
Okay, well, thank you so much, Kim. You were totally on top of this. Oh, perfect. So we're back. Thank you so much for giving us the 10 minutes. It was fun to see. We're trying to post the picture for all of you, so you see what we saw. So with that, we're turning it back to Kim Desmond.
Thank you. Congrats to you all who saw the eclipse. Looking forward to the picture. All right, let's jump back in here so I can save plenty of time to go over the examples. I think a lot of questions is actually, how do you do the work, right? And what does it mean to use behavioral insights and cognitive science to inform work in randomized controlled trials in local government? So I'm going to get to that. I'm going to save plenty of time for that. I want to transition to this conversation in terms of, to get to set up a randomized controlled trial, to get our employees to understand the importance of using data-driven practices. Our team, we want to move individuals from being afraid of talking about racism and understanding what that means. A lot of individuals in local government are afraid of talking about racism and what does it mean to critique racial disparities in our city services, in our city systems. And so our goal is to ensure that we move from individuals being avoidant about talking about racism and disparities to being very explicit about how they approach past policies that create current day disparities to dismantle systemic racism. And so essentially, we're living out the decisions that were integrated in our systems. Historically, those things create current disparities around home ownership. I gave you all the example of the flood that we had here. It wasn't a coincidence, and I was not surprised that the higher flooded areas where we had our levees and our dams, that those places that was historically redlined was in neighborhoods where Black and Latin folks and also folks who were Jewish could not live in any other places. And so just know that we want to make sure that our individuals in our city are not afraid of that, right? And also, we're not trying to say that by addressing racism by our ordinance that we're leaving out any other race ethnicity, or we're leaving out our white folks in our city as well. We have white folks who experience, if you are a wheelchair user in our city and you are white, you also may experience structural inequity in our structures. And so it's not a competition, it's that everybody needs something differently. And based on how you're positioned in the society, we want to make sure that you're not afraid of talking about how that need may shift based on your racial, ethnic, demographic. And that's where you actually go towards being explicit around setting equal goals. You set a goal where you say, we don't want any of our neighborhoods to experience high levels of flooding. Now, if those particular individuals are, as they were and currently are Black and Latin folks, then that tells you something around the historic part of it. And so these are all things that as you're creating new policies, will always be conscientious of the demographics and how they impact folks differently. And understanding that our demographics, they interact with each other. You can be both race, ethnicity, living with disability, as well as be a part of our LGBTQIA community as well. And so we want to make sure that you're conscientious of the way in which your identity interacts with systems and historically how that creates disparities. And we don't want our employees to avoid those hard conversations if they're making policies and they're not clear about how those policies impact individuals differently. You may further create more disparities. Policies do not impact people the same. I will just say that. Based on where you live and who you are, policies may impact you differently, right? So if you're unhoused, a policy may impact you differently if there's things that does not apply to your current circumstance. So with that, as I'm working with our administration and with our mayor directly, it's being clear when you're designing equity. I like to say, and there's a saying that this is that you have to design equity into systems to change the outcome. And with that, you got to be very clear that what is the political agenda of our policymakers and what is the degree of influence and control as our city council and our mayor, our elected officials, they are making the decisions to adopt a massive $5 billion budget in 5 operating categories. And that budget is created to serve the people in the city. It's created to make sure that your trash is picked up on a timely manner. Is built to make sure that we're preventing sinkholes or identifying any pipes that may burst or break. It's built to make sure that you can go to your local parks and rec center. It's built to ensure that you can go to your library as well. And so a city is charged with doing a lot of things, including monitoring your drinking water, right? So we want to make sure that that $5 billion is being utilized to provide the best services to our neighborhoods and to ensure that it's impactful. And so with that, all that is in the degree of influence and control of our elected officials. Now to the right, that's the operational side. That's the 30 plus departments where you just can't come in and tell someone to do something in one day. These are things that have been done in policy and practice and budget decisions over decades. And so that's why my team, we create plans to ensure that everybody's in the same, going towards the same direction. All 12,800 of our city employees, so that way we can deliver all the programs and services to all of our neighborhoods. And with that is the assessments and the data. And we do that to make sure we're creating the equitable outcomes. So just know as I get into the examples, you will hear me reference back, what does it mean to design equity into our systems? And what does it mean to design equity using a behavioral-informed, behavioral science approach to creating randomized controlled trials to make sure the data that you're using is assessed equitably and inclusively. And so back to just our model, I want to just keep framing this so you are all able to kind of see how at this point in time, our employees are going through this process. They're creating the plans and the strategies. They're working with the elected officials, the mayor and the directors to say, how do I get this work done? And so with that, each department in the city of San Diego, they actually have these plans. They've been working on them for the last year. Our goal is to release them. And so every department has to identify what their equal standard is and what the disparity is in their particular work. And so just know that disparities in our Parks and Rec Center, it looks like we don't have the same number of programs serving kids of color as we do in our neighborhoods where we have more white kiddos. And so we have clear disparities by race ethnicity here in San Diego in our program offerings in our rec centers. That's different than our library, different than our stormwater and our transportation systems. So every department will have a unique technical equity plan. And our goal is to make sure that those goals fit into the context of their particular plan And we're working on making sure that they're addressing what's the equal standard. Everybody needs quality water, or not to, get flooded. Then also, what is the disparity? And so these are all things that we've been coaching folks on for the last year, our departments. So now here's the fun part. Want to get to evidence-based interventions, which is why I know you're here. And so, as I stated, I've had the opportunity to work with Dr. Elizabeth Linos out of the Harvard Kennedy School. And this is more certainly, we're in the process now of getting our research portfolio ready for the city of San Diego. While I was in Denver overseeing that particular office, I was able to be a part of many projects that are actually now headed towards publication, because we did launch a couple of randomized controlled trials in the city of Denver. And so Laura actually put the link to those studies in the chat box. So like I said earlier, please check out the work of the People Lab at Kennedy School. They're doing awesome things. What you see in front of you is a quick, simple process that I walk through with departments as we do the work. And the work that I do, we call things equity opportunities. You have to identify what you want to change. Is it a policy? Is it a program, or is it a practice that you have identified to address more equitable outcomes? And then step number 2 is, what is the data telling you? This is one tricky part about government. Not all data is available to the public. We hire lots of consultants to do fun studies like the condition of our streets, how many potholes we have and where. We actually know where the quality water is not at. We know trash service. We know Parks and Rec. And so just know that there's a lot of assessments and studies that is not available to the public. So when you're doing a randomized controlled trial, you have to make sure that your academic partner has access to that type of data, because you can't go and pull it down from the US Census. This one is important only because you cannot just go and say, you know what, here's a random evaluation, go and fix it. If it's not in context of the government study or assessment, our department directors will not know how to move forward. And so data informed means understanding that not all data is collected on the US Census. Departments hire consultants all day long around assessing a particular service in the city. And this includes data from our internal employees as well, which you will see as an example of one of the case studies that we completed in Denver. Inclusive engagement. You want to make sure you're always including individuals that are impacted by what you're doing. That includes staff, that includes the neighborhood folks who are impacted by potholes and transportation needs. And so inclusive engagement means you want to always talk to individuals, conduct interviews, and compile studies. Equity lens means understanding that everyone is impacted differently based on where they live and who they are. And so you got to have that into context in regard to the historic impact to racism, and that everyone is not going to interact with government service in the same way. And so an equity lens allows you to tease that out, to say that individuals experience disparities in a very nuanced way. Then you get into designing the evidence-based intervention to use those data insights from behavior science to design and test the strategies to address the biases. This is my favorite part about doing evidence-based work and using it in behavioral science. I'm not making it up. Oftentimes in these positions of power and influence, we're paid to just offer our best idea without really checking to say, why is that the best strategy? Using behavioral science, you're able to evaluate that this is not just my opinionation. I've used a process to make sure that we are implementing things and that we have rigorously tested it. Like, that's the key. You want to rigorously test what you're evaluating before you go and scale it. Sometime in government, we'll roll out a new program without testing it. So we want to roll out things that we know are going to work, that's going to get us the best outcome for our folks. And then based on that, you want to then monitor, and then you want to scale it, right? I want to give you all some examples of this. In the chat box, you have a link to this particular publication. This is one that I was able to do with Dr. Linos, and here's the background to this. I was in a government meeting before, and I asked our housing department, do we know how many people in Denver has utilized rental assistance more than one time? And no one could answer the question for me. And so after that, we actually partnered with that department to create this study. And so we did a randomized control trial, and our focus and our opportunity was around the rental assistance program. As an outcome, we were monitoring eviction prevention. So we are making sure that if I give someone rental assistance, is this preventing them from getting evicted and also entering into being unhoused? And so know that we are monitoring, at that point in time, it was like a $3 million allocation that was spent in like a 2-3 month time. And we couldn't tell when I asked the question, how many of those folks got evicted or came back for a second allotment of resources. So our experiment, our RCT, found that by providing information around rental assistance in this, it is an anti-poverty program, you got to make sure that you are communicating in a way that's effective, right? And so when we identified this equity opportunity, it was a way to really explore the program. It was rental assistance. As we dug into this, we looked at the opportunity around ensuring that in that experiment, we wanted to make sure that folks understood that they had to go towards looking at the actual rental assistance application. So working with Dr. Linos and team, we worked with our community contracted providers, and we looked at the demographics for all of those rental assistance applications. And we actually made sure that we had budget allocated towards doing some targeted testing around different messaging that would destigmatize the way in which the money was utilized for rental assistance. And so with that, the data-informed approach meant we had application type with all the different demographics. I'm talking race, ethnicity, location. And so based on that, we did a targeted RCT, randomized controlled trial, that made sure that we group folks to say what message would encourage folks to apply for assistance, right? And so as we got towards this particular level of work, it's important to say, you know, how do you set this up? You don't just give an academic partner all that data. Turns out you have to work with the city attorney. And so my role was to work with the city attorney's office to help structure a data use agreement and to make sure that our contracted partners understood with our housing department what they were signing up for. Last but not least, we also made sure that I brokered a conversation with our county court judge to do a hold to give us access to eviction data. Because mind you, we were tracking with the RCT eviction, right? So you don't just get access to eviction data, it goes through the justice system. So I had to work with the judge to get a judicial order for our academic partner to get access to that data to analyze it as a part of the randomized control trial. So I'm giving you all this context to say, and here's what I need to talk to you all about this in detail, to say, you don't just happen upon a randomized control trial. It is meticulous work. You have to build in the structure to do so. You have to have the data use agreement. You have to have the political support, as you saw that slide that I had, where the level of influence from your electeds help push this through. So when I was in my position in Denver, the elected Mayor Hancock, his team, they made sure that I had access to the city attorneys to create the data use agreement, which then would help us create the randomized control trial, which would then allow us to do the behavioral randomized control study to introduce some more strategies. So with that, what we found out, which was very interesting, when you actually apply the equity lens, and when we actually sent out approximately 50,000 to 50,000 renters in Denver on 2 separate postcards advertising the rental assistance program, we found out that renters who received this program and how they apply for it, there was certain language that could deter folks based on our marketing. And so what we did is that we worked with Dr. Linos' team to really destigmatize the language in the postcards. So imagine being at home and you need help with rental assistance. And you all will get this from a cognitive science, behavioral science standpoint. It turns out that based on the randomized control study that we did, is that when you destigmatize the language, that the motivation for our Black and African American renters were different than our white renters. And so what that meant to us was that how you communicate to different audiences and what you say, it matters in your marketing about a program. We would have not found that out without doing the randomized control trial. And so we did see some increase, most certainly, with that particular demographic. So the equity lens, it allows us to say, people receive information based on where they're at in life differently, and we got to make sure that we're asking those questions. So here's some simple equity lens questions. As you can see here, we're talking about, for this example, the rental assistance program. So you identify that as an equity opportunity. And then after that, you say, how does that impact folks differently? What is the burden to that program? We saw an underutilization of our Black renters utilizing the rental assistance program. So we had to make sure that we were making sure that everyone had access to that program. And if it meant just tailoring the communication, then we did so. And so what we did see in terms of the evidence-based intervention is that renters that received the postcard, they were 52% more likely to request an application for rental assistance and 24% more likely to submit an application based on not receiving a postcard. So essentially what we saw was that it matters how you communicate to folks and let them know that the government resource is there for them. And so this was one of my favorite projects in Denver, was the destigmatizing project. And just going through those steps, my role was to help coordinate, get the data use agreement done, get access to the data to structure the randomized control trial, utilize the equity lens to keep things moving. It was a project that was very lengthy for our team. And I also paid for the actual 50,000 mailers from my particular office at the time. And then here's the fun part, right? You go in and then you communicate it, right? You communicate it, you talk about what you're doing, you implement it. We work with our partners to say, here are the things that work. And we looked at how we can frame the language differently to make sure that the people who needed rental assistance was getting it. And mind you, I was able to get the judge to do an order to give us access to eviction data. So we're monitoring that as well to say, if you're getting rental assistance multiple times, did that prevent you from being evicted? And if so, who's applying and who's getting evicted? These are all the fun things that come across of doing a randomized control trial. So check out the link. That's this part with all of our partners that was involved in the work when I was in that position. Harvard Kennedy School, the city attorney's office, spent lots of hours with them. And so check out the link so you can check it out. Last but not least, I want to share with you one last study so I can open some time for questions. And I know, Laura, we're on track to maybe leave 10 minutes for questions. Am I correct?
Yes, that would be great.
Perfect. So this last example was one that's a more recent one that the Kennedy School just turned into a case study. I chose this one purposely because it focuses on our workforce. And I want to start with just saying that the equity opportunity actually involved the disparity in mass incarceration in our justice system. So we most certainly have a lot of sheriffs in Denver who were experiencing and witnessing a lot of violence and injury and death on their job, right? And so the quote you see here is actually a quote from the sheriff of Denver, who I'm actually still close with to this day, where he always would tell me that the crime should never be a deprivation of your humanity. You shouldn't go to jail for a minor littering fee and then get killed, right? So you should get a fee, pay the fee, and then you leave. And so as a result of that, a lot of our staff, our deputies, they were witnessing a lot of these types of injuries and deaths. They became desensitized, and a lot of compassion fatigue stood in there. So working with Dr. Linos, we chose to look at a compassion fatigue project and launch a randomized controlled trial. I was assigned to work with the Sheriff Department at that particular time. And the equity lens on this is that the city was actually spending out millions of dollars around settling these types of cases. Michael Marshall was a 5'4", 112-pound Black man who actually was navigating some behavioral health challenges, and he was awaiting charges for trespassing and disturbing the peace. So he actually he passed away. It was brutal homicide, and so the family received a settlement. And so we wanted to figure out, how do we make sure that our deputies are responding and not allowing that to happen again? So as a result, I was assigned to work with the Sheriff Department, and I brought in Dr. Linos, who we partnered with the Sheriff Department. We know that we were looking at doing some data around 2 large facilities who care for around 1,700 individuals that were held in those conditions, and the majority of those folks were actually Black and Latin. And we know that we had to do something. and we wanted to use a randomized control trial, and we actually interviewed the deputies to get the solution. So there's the kicker there. We didn't know what the solution would be until we conducted individual interviews with the actual deputies and asked them, you know, what is stressing you out? What do you need? And turns out what our deputies needed was ways just to get advice from their colleagues who, if you're experiencing someone who's doing something in the jail, let's not do something like, you know, put your knee on someone's neck. This is just a real example, right? And so these are all things that we got the advice from doing the interviews with the deputies. I personally had to help schedule over 20 offsite rooms because deputies didn't want to let their leadership know they were talking to researchers. And so engagement meant talking to the employees around what it means to feel burnt out and witness those things. We then implemented the RCT, co-designed it, and it was a peer support approach to the RCT. So we implemented it with all the deputies of the particular randomized assigned of the two groups to really track those changes. Because with the RCT, you want to be clear about the control group and see what's being measured. And so this particular one is a case study that's, as in true Harvard fashion, it turns out you all don't finish case studies, you keep people coming back. So check it out. The link's in the chat box, but just wanted to give you all some examples of what does it mean to actually design a behavioral-based approach in government to really move equity forward. And so I'm going to stop my screen to really just allow for some time for questions, as I know I've talked at you for a good clip of time. I wanted to give you all a preview of what does it mean to do equity work in government? What does it mean to design equity in systems? And actually, I'll end with this, and then Laura, I'll open it for questions after this slide. There are no simplistic solutions for complex disparities. We want to make sure that the projects are relevant to departments to cultivate the mindset. We want to make sure that our departments have the right plans in place and they're using the equity lens. We want to make sure that we are leveraging the influence and control of the elected officials to move the work forward. We want to make sure that we understand the social and political context for the work. And last but not least, we want to always make sure, in my position, I always lead with evidence-based interventions. This work is too important to dismantle racism. I don't want to make it up. I want to use evidence and use data insight from behavioral sciences to design and test the strategies. And that's just my personal commitment to the work, is to ensure that if I'm going to have some impact in this work, I want to make sure that the evidence-based interventions are tested and they're relying on behavioral science. And so that's why I use a lot of data and behavioral RCTs in the work that I do. I will stop to see if there's any questions from you all around any of the projects. And mind you, we're setting up more in San Diego as well. Any questions or thoughts?
Thank you so much, Kim. First of all, please join me with a huge round of applause.